Hey guys, how are you doing? Sorry about the delay. Hope you can hear me. Amazing. Trying to share this link because I had issues with the first one that I created. So permit me to take some time out to copy the link and share. But those who have subscribed before and have turned on the notification bell will be able to see the video easily. And so if you are watching now and you're yet to turn on the notification bell, I think this is the time to do it to avoid missing out anything like this. I tell you every time that the year cannot be compared. So go ahead and turn on the notification bell. So whenever I go live like this, you won't be able to see me. I was about to say hallelujah. Okay. So today we'll be talking about premenstrual syndrome. Okay, so I started last week, but I don't know what happened. The whole stuff went off at some point. So I hope that will not happen again today, so that I can be able to share all that I need to say completely. Okay, so let's get right into the video. So do you sometimes feel awkward? Do you sometimes feel like you're having symptoms, but you cannot really uh, pinpoint what is actually happening? I'm sorry, you'd hear some noise. Just bear with me. It's gonna get better with time. It's gonna get better. Okay, so you feel sometimes you feel cramps, you feel moody, you feel bloated, you feel all of these symptoms, and yet there is no bleeding, there is no blood. You cannot see one spot on your panties, and you're wondering, it's not my menstrual period yet. Why am I feeling this way? Now, some of these things that happen have explanations, why some of them do not have explanations. So, but for this feeling that you get once in a while, maybe before your period or during, can be explained. And this is what we call premenstrual syndrome. Now, if you're a guy watching this video, I want you to stay tuned because this is as well useful for you. Because by understanding this, you'll be able to identify the symptoms. Once you identify the symptoms, then you can be of help to whoever is going through the symptoms. All right, so I'm going to be checking my notes so that I would not miss out any of the things that I have prepared for you. So, what is premenstrual syndrome? Premenstrual syndrome, from the name pre and menstrual, it is a couple of symptoms and signs that happens before the menstrual period. Now, the word syndrome is syndrome, like you see in the title. Syndrome refers to a couple of symptoms and signs. Now, maybe I'll be sharing the link to the post where I explain the medical terms. Signs will refer to the things that happen to you and are visible to others. We call them objective data. Everybody can see when you're slim, everybody can see when you're fat, everybody can see when you're dark, everybody can see when you're fair. Those things are obvious to the other parties to see. While symptoms, we call them subjective data. Sim- Subjective data. Symptoms are the feelings that you get, but only you can experience it. For example, only you can know where you're feeling pain. Only you can know where you have a stomach ache and this and that. While a fever can be, you know, read by somebody else. So a fever is a symptom, while pain is a sign. So in premenstrual syndrome, you have a combination of both. There are signs and there are symptoms. And so these signs and symptoms occur before the menstrual cycle, before the menstrual period. And so before the end of this video, by the end of this video, you would understand what premenstrual syndrome is, how to manage it, and how to take charge even with these symptoms. So let's go right into the definition of premenstrual syndrome. So like I said earlier, premenstrual syndrome is a series of physical and emotional symptoms and signs that a woman can experience about 1 to 2 weeks before a menstrual period, before a menstrual flow. Not everybody experiences this every time, but you see, it's a common symptom, a common syndrome, a common condition that happens to 3 out of 4 women. That's a lot. 3 out of 4 women will experience premenstrual syndrome. Now, at least one sign. It's at least one sign. So, by the time I begin to list the sign and symptoms, you may not experience every one of these things that I'm going to be talking about, but you would at least experience one out of this. And so, if you at least experience one out of this, it is still premenstrual syndrome. Do you understand? Now, there's a severe form of premenstrual syndrome, which is referred to as the premenstrual dysphoric disorder. Premenstrual dysphoric disorder is a very, very severe form of premenstrual syndrome. Now, premenstrual syndrome varies from mild to very severe. Mild in the sense that you may not even know that you're experiencing the signs and symptoms, and very severe in the sense that it affects your activities, it affects the normal day-to-day activities that you should get yourself involved in. And I called it what? Premenstrual dysphoric disorder, PMDD. Now, this affects about 3 to 8% of postmenopausal women or premenopausal women too, because these people are approaching the menopause where menstruation stops or ceases to happen. And so several things begin to happen because the hormones are raging, this and that. And so premenstrual, dysphoric disorder may occur. I do not want this video to be too long, and so as much as possible, I'll give you all the data that you need, not just data, but explanation with real-time examples, and at the same time, I'll be as fast as possible. So if I'm too fast, you can put the how do I put it? You can make the playback, you can make it slower so that you can hear what I'm saying. But I hope I am not too fast. Okay, so let's go right into the causes of premenstrual syndrome. Now, the actual cause of premenstrual syndrome is unknown, what we refer to as idiopathic unknown. You can pinpoint that, oh, this causes this. For example, um, plasmodium causes malaria. Straightforward. But we cannot pinpoint what causes premenstrual syndrome, although there are several factors that can contribute to premenstrual syndrome. And I'm going to be listing these factors. Now, some of these factors are changes in hormones. Do you know that the woman body is an intertwine of several hormones? Estrogen, progesterone, and all of these and all of that. All of these hormones, sometimes they can rage and cause several symptoms and several signs and several issues. And so they can aggravate the signs and symptoms that happens before menstrual period. If I see enough engagement on this video, I will be releasing another video where I'll be explaining the menstrual cycle in a very simple way that even your 6-year-old kid can understand, or your 6-year-old sibling. So I hope I get enough engagement on this video. I hope you like, I hope you comment, I hope you share, I hope you ask your questions. And when I see a handful of engagements, I'm gonna get that video right out. It may not be a live session like this one, but it's gonna be out and you're gonna enjoy it, you're gonna understand it, and it's gonna help you. You know how to calculate your safe period, you know how to calculate, how to determine the sex of your baby. If you want to have a baby boy or a baby girl or twins, whatever it is, you would know how to do all of that in that video. So now let's continue with the video. So another thing that can aggravate or compound the symptoms of premenstrual syndrome is an increase in estrogen and progesterone levels. I told you estrogen and progesterone are the the hormones responsible for menstrual cycle. So when they are too much, they can cause increase in mood swings, anxiety, irritability, and what have you. These are the things responsible for the changes that we see. Don't mind me, I'm looking at the screen once in a while, and that's because I have my notes there. Over time, I would find a way to sort out, getting my things more concise. But at the same time, I want you to focus on the value that you're getting. All right. Okay, so another thing that causes or aggravates the symptoms is stress and emotional problems, such as depression, this and that. When somebody is stressed, it can cause an increase in the symptoms felt, an increase in the signs seen, and it can really be mind wrecking. Mind wrecking. Okay, so all of these things can contribute to premenstrual syndrome. Subsequently in the video, I may be saying PMS, premenstrual syndrome, instead of premenstrual syndrome. Okay, so it may contribute to what? PMS. Now, what are the risk factor of PMS? What are the things that, when present in an individual, positions him to, or positions her, sorry, to be a victim, let's put it that way, of PMS? One of it is the family history of PMS. Probably there's an history of PMS. Your mother had PMS, your sister, or maybe you have some mental issues in the family like depression, substance abuse. It can pose you, or it can expose you to the risk of having PMS yourself. And also, if there's a past medical history of postpartum depression, probably you have a child already, and you had maybe postpartum depression after your first child, you have the risk of having premenstrual syndrome. And if you have a mood disorder, it's also a risk for premenstrual syndrome. Now, another risk for premenstrual syndrome is having at least one child. If you have at least one child, or someone that has at least a child, is at risk of developing premenstrual syndrome. Okay, so let's go right into the symptoms of premenstrual syndrome, the signs and symptoms of premenstrual syndrome. Remember, I defined premenstrual syndrome as the physical and emotional changes that occurs, that happens to a woman or a lady before a menstrual period. So we'll be taking it in two parts: the physical and the emotional changes. Now, these symptoms vary, like I said before, they vary from slight to very intense. And a lot of times happens to women in their late 20s and in their early 40s. So let's go right into the emotional changes or emotional symptoms that occurs. Now, the first thing, I'm going to be listing it in no particular order, but it's a whole lot. It's a whole lot. And some of these things happen, like you can see. So there could be poor concentration, change in interest in sex. Poor concentration is that at sometimes you just find yourself blank out. You cannot even understand why or what you're thinking about. It could be a sign of premenstrual syndrome. Then there could be a change in sex. You don't really interest in sex. You're not really interested, or probably too interested if that's the case, but there will be a change. And also, there could be crying spells. Now, crying spells are a result of emotional outburst, which also is a result of the interplay of hormones. Estrogen and progesterone can be blamed for that. So if you're a guy and watching this video and you see that your lady or your fiance or your wife or your sister or your mom is busting out and crying uncontrollably for no reason, it could be that a menstrual cycle or their menstrual period is about to begin. So you know what to do. You don't get frustrated. All you need to do is pet them and care for them. Okay, so another thing that can happen is mood swings. You can have crazy, crazy mood swings. I'm going to be talking about how to manage these things later on in this live stream, in this video. Okay, so another thing is irritability. You can be so irritable, tense, and touchy. It's the hormones. There can also be appetite changes. Now, specifically, there is usually cravings for sugar. That's the point where you want to take drinks, you begin to feel like taking sugar cubes, you want to take any drink or any tea, you put a lot of sugar. It also could be premenstrual syndrome. And these are heads up here. That sugar is going to pose a problem later in the cycle. And also, there could be insomnia, which is lack of sleep. I have a video or a write up on how to effectively deal with insomnia, how to get enough sleep when you have sleeplessness. Then also, there could be tension, anxiety, depressed mood, and ultimately social withdrawal. Because of all of this mood, emotionally, you can just become frustrated and begin to withdraw from people, and it's all part of the symptoms and the signs of premenstrual syndrome. Remember, I told you it's not compulsory for you to have all of this, but one out of all of this could happen. Now, let's go on to the physical symptoms of premenstrual syndrome. Number one, headache. Your head can begin to ache you unnecessarily without cause. Headache. Fatigue. Fatigue is another thing that can happen. You becoming overwhelmingly tired, even without being stressed on, like your body should be stressed. You become fatigued, tired, and this and that. It could be a sign that your period is coming soon. Now, another thing that you could have is joint aches, muscle aches, and all of that. Now, this is one I know that you can relate well with: acne. There's always breaking forth of acne and all of that on your face and on very unlikely places too. But acne is a very common way that people know that their period is coming soon. Another thing that is very common is breast tenderness or swelling, where you begin to feel like your breast is tender, it's painful, it's fuller. When this is happening 1 to 2 weeks before your suspected period, it is premenstrual syndrome. Then another thing that can happen is bloating. You can become bloated, having that feeling of fullness yet hungry, and you can explain it. Looks like constipation, yet it is not. It could be premenstrual syndrome. Then also alcohol intolerance. For those who take alcohol, you just find it difficult to tolerate alcohol, any form of alcohol. Then also low back pain. Your back begins to ache you for no reason. And also there can be weight gain due to unnecessary fluid retention caused by the increase in the hormones. Like I said earlier, the exact symptoms varies from woman to woman. Not everybody experiences these symptoms altogether. Okay? All right. So let's continue. And I'll be talking about how to predict or how to diagnose premenstrual syndrome and what to do about it. Are we together? Please give me a minute. This can pass for a comedy show, right? Pardon me. I'm trying to get more people to join the live stream. Okay, so how do we diagnose premenstrual syndrome? There is no specific diagnosis, there's no specific lab test to do except considering the signs and the symptoms. Now, also, another way to diagnose premenstrual syndrome is to keep a diary or a journal of the symptoms. And so you record it for 2 or 3 menstrual cycles. And so when it begins to happen, you can detect that this is premenstrual syndrome, and you can begin to take action and utilize some of the treatment plans that I'm going to be teaching you or talking to you about. Then another thing is you need to note the day the premenstrual syndrome or the sign occur and the day that it ends. This helps you to take track of what is happening to your body. Welcome, one participant, a new participant that's joined us. What's your name and where are you watching from? I said a lot. You can always back up and check the replay. Then another thing, you need to find out if you have once had premenstrual syndrome or if somebody in your family has premenstrual syndrome. That can also help you to know if this is premenstrual syndrome. Then also, you should also be able to rule out other forms of things that mimic premenstrual syndrome. Hi, Grace. I'm happy to have you here. I said a lot, but don't worry, I'll make the video available so you can watch it through. So, you'd rule out other things. There are other things that can mimic premenstrual syndrome. So, it's not everything that is premenstrual syndrome. You have to rule out the fact that you're not pregnant. You have to rule out chronic fatigue syndrome. You have to rule out thyroid disorder. So how do you rule out pregnancy? You have to do a pregnancy test to be sure you're not pregnant. You have to take a lot of rest to be sure this is not fatigue taking a toll on you. So you can do a thyroid hormone test also to know if it is not a thyroid disorder that is causing the problem. Now to the treatment of premenstrual syndrome. Okay, Grace, I'm happy that you are here. I hope you're learning. The treatment of premenstrual syndrome. Basically, you're not using a drug per se. You're going to use some drugs though, but the first thing you need to do is to have some lifestyle changes. Grace, you can do well to invite your friends. Simply use the share button to share the links to your friends, and they would be able to partake of this that you're learning. All right, so one thing that you should do is to take a lot of fluid. Take a lot of fluid. This eases the kind of the uneasiness that you feel in your abdomen. This eases it a lot. So sorry about that. I had to change my location. I hope you bear with me, and I'm about to finish this video as soon as possible. Don't worry, you guys, it's gonna get better. I trust me, it's gonna get better. All right, so I'm so excited doing this video. That's why I'm all smiles. All right, so another thing to deal with premenstrual syndrome is to take balanced diet, and this balanced diet helps to improve your overall health. You want to be healthy before blood starts trickling or flowing out of your body, before your womb starts weeping. So taking balanced diet helps to ensure that you are fit and ready for the task ahead, which is your menstrual period itself. Then also you can take supplements like folic acid, vitamin B, magnesium, calcium. This helps to reduce the cramps and the mood swings. They help you to eat well folic acid helps, all of this work to improve the symptoms and reduce all of that. Then another thing is that you should ensure that you sleep at least 8 hours per day. This reduces the fatigue and all of that. Then I'm trying to give you all the details as much as possible. Um, Trust me, these things work. There are things that I've tried out. They work 100%. They work 100%. So you need to sleep well. Sleep well. Sleep very well. This will reduce fatigue and it will help you through the process. Then also exercising. Simple exercises like skipping, taking a walk, jogging. Those things help to reduce stress and reduce bloating. Skipping works, trust me, helps you stay in shape. And if you want to go all out, your sit-ups, your squats, all of this, they are good. You can do them to keep stress away. Then reduce sugar intake. Don't give in to your cravings because this will lead to cramps when your period eventually starts. I'll talk about that in my menstrual cycle video. If I get enough engagement on this video, enough likes, enough comments, enough shares, maybe I will do that video. But I promise to do that if I get enough engagement. Let us make this video rank. Yeah. Okay, so eat a lot of vegetables, eat a lot of proteins, reduce. Now, I'm going to be talking about the things you should reduce. Reduce salt, reduce caffeine. Salt causes trapping of water in the body, let me put it that way, and that can lead to bloating and weight gain. Then also caffeine can also stress you, yeah, at that period. It can also cause retention of fluid, and you do not want retention of fluid at this time of your life. Okay, so there you have it. You know what premenstrual syndrome is, you know what the risk factor is, you know what causes it, you know how to diagnose it, and you know what to do when experiencing premenstrual syndrome. So thank you for joining in this live video. I didn't want it to be too long. It's almost 28 minutes, and this is why I say thank you for joining in, and bye. Bye.